Okay, we are live. Let me make sure I'm unmuted. Okay, yes. All right, welcome mamas to the Mom and Baby Nutrition Support Group with Gardner. I'm Alex. I'm a registered and licensed dietitian nutritionist and a certified lactation consultant. And I specialize in preconception, prenatal, postpartum nutrition, and infant feeding. And we go live every week, right at Wednesday at 6 p.m. Eastern Standard Time, right here inside the group, where we cover topics that I get asked a lot of questions about. Oh, and you know what? Oh, I'm at the end of this slide set. Close your eyes. Close your eyes. Okay, there we go. I get asked a lot of questions about how much should my baby actually be eating when they start solid? And so that's what we're going to dive in today. Now, the answer to this question changes from 6 months to 7 months to 8 months to 9 months to 10 months to 11 months to 1 year old. So it rapidly changes because, as you know, your baby grows fast. And so as we're going through this live stream, if you're watching live, feel free to add your live comments in. We're going to be talking about that. So let's go ahead and dive in. So first things first, I have another training about talking about the developmental milestones that your little one needs to hit before they're ready to start solids. I'll go into those a little bit deeper in another video, but they're basically, your little one needs to be able to sit up on their own unassisted, so have good trunk control. They need to have good head control. And they need to be able to, this gag reflex that they're born with needs to go away. And what that is if you put a spoonful of food in your baby's mouth and literally the only thing they do is stick their tongue out like bleh, and it all comes out and none of it is swallowed, that's the gag reflex that they're born with. And it means they're not quite ready to start solids. So you can try again in a couple of days and see if that goes away. So you want to make sure they're ready developmentally to start solids. Now, at this point in time, 6 months old, when they're first starting solids, breast milk or formula are going to be the main source of nutrition, the main source of calories. Your baby will get a few bites of food, but really not enough in terms of calories for it to make much of a difference. This is a time for babies to explore different tastes. Babies learn by putting things in their mouth. They learn by touching. They learn by seeing. So this is a time when babies will probably play more than actually eat. So don't be surprised if that happens. And that's okay because they're getting the most of their calories from breast milk and formula. So at this time, you'll probably start with about 1 feeding per day, feeding, mainly just playtime, really. And you can do as many as 3 feedings if you want to just really increase that exposure. And at this time, babies will eat anywhere from 2 teaspoons to 5 tablespoons of food during the 6-month period of infant cereal, veggies, fruit, and protein throughout the day. You can start with 1, you can start with a couple. It really just depends on your comfort level. Now, I have a pro tip for y'all. You don't want your little one to be fussy when you're trying new foods. Because have you ever been hangry? Because I've been hangry. In fact, I always carry a snack with me just so I don't become hangry. Same thing happens with little ones. So give them some breast milk or formula first and have them settle before trying a new food. Because if they're hangry, if they're fussy, if they're irritable, they're not interested in trying new food. They just want to eat. And so, another thing is you don't want to force the food. So if they're really not interested, don't force it. Come back at another time and try again. Now, one thing I do want to mention as I go through this presentation is that although I give a quantity amount recommendation, it's still important to remember to listen to your baby when they signal you that they're full. We don't want to be forcing food on baby when they have had enough. So just pay attention to their fullness cues. All right, let's take a look at 7 months. So again, at 7 months, breast milk and formula are going to be the main source of nutrition. But we're also going to want to offer foods from all food groups each day. So babies should be trying solids a minimum of 2 times per day, but you can go up to 3. And babies will eat anywhere, depending on the day, depending on how they're feeling, between 3 teaspoons and 6 tablespoons of cereal, fruits, vegetables, and protein throughout the day. Now let's go on up to 8 months. At 8 months, breast milk and formula are going to be providing a majority of the calories, but baby is also eating anywhere from 2 to 4 times per day and anywhere from 3 teaspoons to 7 tablespoons of food from all food groups throughout the day. Okay, now we get to 9 months. So let's stop here because there are different styles of feeding babies. Everyone has their own style. Some people prefer to do the conventional style of feeding where you do purees and then go up to a little thicker and then go up to even thicker. And then you have the actual like solid food. And that's where typically comes in about 9 months. Others prefer to do a different style like baby-led weaning, but that's not what this presentation is about. This presentation is more about guidelines for quantity rather than like what style of feeding. So at this point, little ones are going to have a large portion of their calories coming from breast milk or formula, but they should also be eating at this point in time at 9 months old 3 meals per day. And when I say meal, it's a baby meal. They're small. It's not I said human size. It's not adult size meals. You're gonna aim for about 1/4 of a cup to 1/2 a cup of each food group throughout the day. And now when we get to 10 months old, again, breast milk and formula, still very important and a substantial part of the diet, but food is becoming just as important for nutrition. Babies should be eating at least 3 meals per day in addition to their breast milk or formula, and they should be aiming for about 1/2 a cup of each food group spread out throughout the day. Okay, now we come up on 11 months. So at this point in time, baby's probably drinking anywhere from 3 to 4 bottles or having anywhere from 3 to 4 nursing sessions per day, in addition to 3 meals and usually 1 or 2 snacks per day. And so we're going to be aiming for about 1/2 a cup plus a few extra tablespoons of each food group per day. Now, when I say 1/2 a cup, that doesn't mean it has to be pureed. It can be just in general, like if you're looking at a 1/2 cup measuring cup, about that much volume of food and throughout the day. All right, now we got to 1 year. So at this point, your baby is a year old. Your little one will be getting almost all of their calories from food. If you're formula feeding, your doctor and pediatrician are going to say, all right, it's time to switch to cow's milk. If you're breastfeeding, you're typically breastfeeding anywhere from 2 to 3 times per day or until you or your baby decide they want to wean. Let me stop here though, because we want to be careful with cow's milk because sometimes, and I've worked for WIC, and I've seen a lot of times where toddlers will only drink milk and really not leave room in their tummies for food. And so the recommendation is we want to keep milk at 2 cups or less per day for toddlers because too much milk can lead to a lot of problems like iron deficiency, constipation, all of that nasty stuff that we don't want happening. So I've got some frequently asked questions that I get a lot. So 1, does the order of how you introduce foods matter? What I mean by this is some people say you have to introduce vegetables first, because if you introduce fruits first, babies aren't going to want to eat vegetables. Evidence now, it doesn't say that. You can introduce whichever food first that you want to introduce. Time. Do you have to wait a certain amount of time between introducing 2 new foods? Well, there's some mixed results on that. Some professionals say you should wait about 3 to 5 days and only offer a single food at one time. So for example, you offer strained green beans the first day and you wait 3 days and you offer carrots and you wait 3 days and you offer apples. So what that's happening though is say you offer one every 5 days. There's 30 days in a month, right? So that's going to be only 6 new foods that they try every month. And we want to get baby used to lots of different variety and flavors and nutrition. So I am hesitant with that because the other professionals say it's okay to offer new foods closer together, like every other day, especially low allergen foods like fruits and vegetables. So that's something you really need to talk with your healthcare provider about, weigh the pros and cons of that. And of course, if you start to see a reaction to something, look back on what you had the past couple of days and you can try to figure that out. But the reason they say to do that is because if baby was to have a reaction, you'd be able to see which food caused that reaction. But for things that are low allergen, like fruits and vegetables, that's why I'm hesitant, because I would rather baby be exposed to a variety and high number of different foods than to be limited in that. Another thing, purees or baby-led weaning, what's the best? Well, that really depends. It depends on you as mom and dad and grandparents and caregivers on what you think is best for your little one. Baby-led weaning, some people say, oh, you can't use purees, but purees are just another texture. Baby-led weaning is more where you give baby the autonomy to feed themselves. So instead of putting the food in their mouth for yourself, you hand them the spoon and they put it in their mouth, or better yet, they take their hands and they dip it in the bowl and they smash it all over their face, and then they get a little bit in their mouth. So really, there's just different ways to look at it, and one way is not necessarily better than the other. There's a lot of factors that go into that, and it really just depends on a discussion between your healthcare provider and you and your comfort level. So that's definitely something you can bring up as well. But if you have any additional questions on how much you think your baby should be eating, these frequently asked questions, feel free to drop those in the chat or reach out to me, and I'd be happy to answer those and could possibly do another live training answering some more of those questions. Man mamas, I really, really appreciate you joining me today, and I look forward to seeing you all next week. And this Sunday is Christmas, so have a very Merry Christmas to all of you mamas out there. Bye.